Gillian Schmitz is going to talk to us, and this is a very provocative talk, I think. When you have conflict, and I bet all of you can think right now of a conversation that you're going to have with someone that you're just dreading, how do you resolve it? Are there some tips that we can take and bring to the conflict resolution tutorial? Anyway, thank you, Gillian.
All right, anyone gotten in a fight with somebody recently? Anyone seen someone just act out of their mind on social media and you're like, who is this person? I have never seen a time where we've had more tension within the college, within our specialty, and I would argue even as a country. People's fuses are just a lot shorter. We're a lot heavier tempers, and it's become a really hard time to have that leadership that David was just talking about. And this is going to build off nicely, but understanding that conflict and leadership go hand in hand, right? Conflict, it's an all-contact sport when you're in leadership. And you can't avoid it. If you avoid conflict, it's just going to escalate and spiral even faster. So our job as leaders is to recognize conflict, to understand the nature of it, and to help de-escalate and come to a swift resolution. So someone asked me which books, if you had to read some leadership books, where have you found a good topic? There's a couple I want to highlight. Doris Kearns Goodwin is a presidential historian, and she's written about several of U.S. presidents who took charge during a very tumultuous time in our country. And she highlights how they navigated, really on personality, to deal with these monumentous leadership challenges. And Abraham Lincoln was one of them, and he really leaned heavily on humor. And he was kind of a funny-looking guy for the time. He's tall, lanky, but he had a lot of self-deprecating humor that worked really well in engendering trust and building relationships. And another one I would highlight is High Conflict. It was written a few years ago by Amanda Ripley. And high conflict is just that force that keeps you up at night. When you start grinding your teeth and you feel your blood pressure going up. It's those ideologic disputes with people you've maybe never even met, a politician, a CEO, some hospital leadership, something that you're so frustrated about that it just drives you insane. That this is becoming more and more prevalent. And it is not completely avoidable, but it's important that we learn how to shift ourselves and others out of that state of high conflict and into a state where we can really negotiate and interact with other individuals. And I would argue that those of us who work in the emergency department, we're the experts at conflict, right? We're the ones who have to handle the angry patients who've been waiting 16 hours to be seen, to deal with our consultants who are also short-tempered and you're talking on the phone, and how to bring everyone together to navigate that problem to solve what is best for the patient. Now, I promised Sherry that I would not talk about politics, so I am not, but I use this as an example as a great understanding of high conflict. Just everyone in this room is highly educated. There's a diversity of opinions about politics in this room, which is why we're not going to go there. But from a purely scientific standpoint, isn't it fascinating that 38 million people stopped talking to a family member or a loved one after the 2016 election? Stop talking. 38 million people. And that probably went up even more in the most recent election. How can so many educated people look at the same set of material and have such different perspectives and such utter conviction that they are right and someone else is wrong, that we can look at the same data and believe they're two totally different information and facts? Part of it is explained by social media, increasingly so for the younger generation that use this as a form of communication, where the algorithms for social media is intently driven to drive conflict. The ones that are more engaging tend to get more likes and rise up to the top. Even our news outlets and channels are sensationalized on both sides of the political aisle to try and sell ads to get viewership, and that charges us emotionally. So what creates conflict in the workplace? I'll skip through a lot of this because Dr. Seberg did a really nice job of covering it. But there's a lot of ego. There's a lot of competition in what we do. And sometimes it's just people having a bad day. But it generally comes down to poor communication and inability to control our own limbic system, where the amygdala goes haywire, and literally your brain is wired differently when you're in that state of high conflict. But I'd argue that not all conflict is bad, right? Good conflict is actually healthy. It's productive to bring different viewpoints into a boardroom or your CEO meeting to get different perspectives on the problem and have people disagree. That's actually a good thing. It helps us share a different perspective and to look at things through a different lens. And this is a picture of me in an ASAP board meeting. I don't remember this picture being taken. I don't know who did it. But it makes me laugh because it demonstrates several of these principles with one picture. One is I was trying to use self-deprecating humor. So I took off my ASAP scarf and tied it in a Rambo fashion around my head to clearly articulate to the person speaking that I disagreed with what they were saying. My body language looks like I'm kind of pissed, but really I'm laughing. And more importantly, I've pushed the microphone away from my mouth, right? I'm actually covering my mouth. I'm not trying to speak over someone. I'm not trying to interrupt them. I'm listening. But I'm listening, understanding that I disagree. And the number of times I walked into that board meeting knowing I have the answer, this is how it's going to work. And then I would listen to one of my amazing colleagues speak and be like, you know what? You're right. I totally didn't think of it this way. We need to rework this and to come back. We need more of that, not less, to be able to have healthy, productive conflict and discussion in our work groups. So Dr. Seberg touched on this and how important it is to communicate, particularly in a leadership role when something goes bad, of getting ahead of the messaging and having accurate, timely, and concise information. How many people have ever taken the DISC questionnaire? This is about your personality. About half. Okay, so for those who haven't, and there's some out there, the theory behind this is that everyone has a primary personality trait and a secondary one. And there's 4 of them. So D, this is the dominant people. They are drivers, they are doers, they are the chief residents in a medical organization. They're often the CEOs and medical leaders because they are doers. They get things done. The I's are kind of the imaginative, the influential. They like to think outside the box. They get really frustrated with people who keep doing things the way they've always been done because they have a higher risk tolerance. They want to push, they want to innovate, they want to drive. The C's, they're really data-driven. How many people do you know that are C's, that you can't just come to them with, hey, I want to do this, here's a nice little story. They don't care. They're like, show me the data. Show me the graphs. I bet Jim Augustine is a C, right? Show me your numbers. I want to see a cost analysis of how this is impacted and how it works. And they need that data to be able to communicate with you. And the S's, they're all about the teamwork, right? Bringing people together. They don't really like conflict. They'd rather somebody else handle that conflict. They really want to see everybody involved. They're like the glue that brings the team together. And this is fascinating, is if you do this within your organization, you're going to see how people have different personality types and how differently they interact and how that can drive conflict within an organization. And I'll give you an example. So my primary and secondary language is D. I work really well with other people who are Ds because I'm like, let's go. I like to get things done. And in my residency, my chief was an S, and they were all about bringing people together. And when we did a meeting, he would like to go around the room and everyone would do introductions and tell a funny little story about something. And I would be like checking my watch, and I'm like, we're like 25 minutes into a 60-minute meeting, and we have not started the agenda yet, and I'm losing my mind, right? But when I ran the meeting, and I was like, boom, let's go, we're jumping into the agenda, it really kind of was off-putting to him. And it was stressful to him because he needed to know who the other people were in the room and what their role was, and kind of warm up and get to know them. And when we did this, we actually found a solution of how D's and S's can interact better. And so we made a new agenda for when we met. We would set a timer for 3 to 4 minutes. And we would do real brief introductions, maybe a quick anecdote about people's weekend, and then jump into the agenda, and it worked much better. But there's all kinds of actually heavily researched studies behind this of when you find someone in your group that you're kind of butting heads with, understanding how they communicate, how they work, and avoiding that conflict by using some of those strategies. Anyone know that person that is really kind of, they like to stir the pot, right? They're conflict entrepreneurs. Most sane people don't rush to conflict. We like to find some other way to deal with it. Now, most leaders aren't afraid of conflict. Like, they'll eventually get there, and if it's something that is core to their mission, their values, they will fight to the hill. But they usually try other strategies first. These people are almost pathologic. They actually get energized by conflict, right? They're adept at these emotional tirades. They like to reduce things to the binary. It's us versus them. It's A versus B. There is no middle ground. They tend to use sweeping, grandiose language like, this is war. And you're like, no, it's not. It's a blueberry muffin. Like, it's not war. Just let it go. These are people, the only thing worse than this is leadership who doesn't immediately mitigate this, because they will tend to spread that negative energy throughout your entire organization and department. So it's identifying it early. It is either getting rid of them or handling it right away to show them how problematic this can become, because it is extremely flammable. And if not dealt with early, it will spread quickly throughout your department. So how do you recognize this has happened? You want to listen for that kind of sweeping, that grandiose, almost violent language. There's often a component of rumors or myths, sort of half-truths, and kind of some conspiracy theory behind it. And the problem with the half-truth is there's enough there that people tend to believe it. And high conflict tends to erupt in situations where there's low trust. Right? If the organization is already feeling that stress, that conflict, they think that the CEO or the hospital administrator is out to get them, they want to have reasons to have that tension. They want to believe it, and they will. And so this is why we have to recognize this and really help them understand that it actually is not binary. Right? What happens is everyone in the middle takes themselves out, and so it gives this false appearance that there's either extreme. And in the reality, there's a lot in the middle that can be negotiated or collaborated, and helping break down that binary and show them that there's many more options in the middle to find kind of that middle ground. And when to just take a breath and let it go, right? When is it not worth trying to fight with these people? Because no matter what you say, they are convinced they're right. You're never going to make headway with them. When is it not worth your energy to pursue this conflict with them and just decide you have to go separate ways or change the organizational structure? And Dr. Seberg did a nice job of covering kind of that emotional impact. And I think a lot of us working in the emergency department are at high risk of a lot of these things that impact our decision making, whether it's alcohol, sleep deprivation, working in a very high volume, high stress environment, and then certainly other things that could be going on at home, family issues, and financial strain. One of the things I was really interested in when I became ASAP president was really the dramatic rise in social media and the amount of animosity and tension that we are seeing there, that many of us have tried to pull off some of those platforms because they have become just so negative. Of when do you engage? When someone is talking negatively about your hospital, your department, your association, when do you get involved? When do you stand up and try to defend yourself? And it really depends how much attention it's getting. Because oftentimes you'll have 2 or 3 people and they're surrounded by their own little echo chamber. And the reality is nobody cares what they think. But if you start interjecting and you start fighting with them on social media, it just elevates things and it gives oxygen to an argument that never needed to exist anyway. So sometimes the best thing is just to ignore it. Keep your mouth shut, let it die. And knowing as an organization, if you're kind of trending kind of these negative and positive comments of when do you have to be proactive and kind of go out there and start your own thread or discussion to combat some of the misinformation or negativity about your organization. And remember that most time people get mad not necessarily because there was a bad outcome. They get mad generally because there was a bad outcome and they felt they didn't get the necessary attention. They didn't feel heard. And Amanda Ripley in that book, High Conflicts, talks about this method of looping, which essentially is just acknowledging the patient or the person's feelings about why they're frustrated and repeating back what they just said in your own words. So let me understand this, Dr. Smith. You're upset because blah, 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 blah. And they start nodding their head like, yeah, she gets it. She hears me. And already they start to de-escalate a little bit. So you're repeating back because it helps you understand, am I understanding? Is this why you're upset? I'm going to verbalize it back as I hear it. And maybe you're not. Maybe you're thinking they're upset about something and they're like, no, that's not it. But sometimes when you recapture what they were effectively saying, it automatically builds that rapport and that trust by looping back really their own words to help them understand that you may not agree with what they're saying, but you can at least understand their perspective. And sometimes, right, they're not angry with you. This is my friend Kate Harrison from San Antonio, who's an incredible emergency physician, and she and I worked a shift together in the ED, and she called a surgeon for an appendicitis, and he yelled so loud that she just held up the phone. And everyone in the department could just like hear him screaming like a crazy man and calling her names and insults. It would have been really easy for her to get back on the phone and start cussing back at him, but she didn't. She paused, took a deep breath, and said, you know, Dave, I've known you for a long time. I've never seen you this angry. Are you okay? And it immediately disarmed him. And he came down later and apologized. He was going through a divorce. There was a lot of other things going on at home, and he just lost it. And we're seeing more and more of that in today's society, where people have lost that patience, that attention to be able to calm their own emotional limbic system and to take it out on the first thing that happens to them. And oftentimes that's what we're seeing. So other de-escalation techniques, you acknowledge their feelings. That's what somebody brilliant suggested for boarding, that the first thing you do when you meet a patient, "Hi, I'm Dr. Schmitz. I'm an emergency physician. I'm going to take care of you today. I'm so sorry for your wait." By apologizing up front, acknowledging the fact that they're pissed that they've been waiting 16 hours, they're already in a better mood just because you've acknowledged how they feel. When it's appropriate, use that sense of humor. Oftentimes that helps patients relax. I usually make small talk about a sports jersey or something they're wearing that we develop that rapport pretty quickly. And find common ground. Where you can, especially in advocacy, if you can share a story, something that helps understand your viewpoint and make an anecdote about something that you've seen, it's very effective. Oftentimes in DC and on the Hill, when you can share a personalized story of something you saw in your emergency department. I highly recommend those of you in leadership to do media training. ACEP does this, another organization does this, but it tells you how to prepare to a message. My friend Sean Conley, who I work with now, was the White House physician when Trump had COVID and was brought to Walter Reed. He never had media training. He came out of his shift and there were 75 TV cameras all in his face asking him very pointed questions on both sides, trying to tell this really sensationalized story. And he had to keep his cool, and he told me afterwards, "Holy shit, I wish I had done some media training." You never know when this is going to happen, but it tells you how to manage a message. It tells you how to get ahead of it. And you never want to repeat a negative message, ever, because that will be the headline. If you think back to prior presidents, right? "I am not a crook. I never slept with that woman." Right? That's the stuff that people remember. So don't ever repeat a negative message. And then we're going to talk about the pivot. And anyone who's ever seen any politician knows the pivot. They're asked a question, they answer a totally different one, but they nail it, right? And they make it look really good. So we're going to see if this video is going to work. This is a joke. I don't want anyone throwing like rotten tomatoes at me, okay? This is a Saturday Night Live skit that's showing an example of how a politician uses the pivot to get out of some negative questioning.
Secretary Clinton, now I'd like to ask you about an ongoing issue for your campaign. WikiLeaks has been releasing your campaign emails, many of which raise some serious questions.
Thank you for bringing up my emails, Chris, and I'm very happy to clarify what was in some of them. I'm sorry, what, Carol? What? I'm sorry, I thought I heard my friend Carol. Anyway, back to your question about the way that Donald treats women. And that is how you pivot.
So you're just never going to answer a question about your emails?
No, but it was very cute to watch you try.
So let's make this contextual to our department, right? Jim Augustine brought up the question of somebody dying in the waiting room. So let's say you are the medical director at your department, boarding has been a huge issue, and there's a death. And you've got 75 news cameras outside saying, "Doctor, you were negligent. We think, should there be criminal charges? Does this person have young children?" Right? It's a nightmare. And you're like, how do I handle this? You use the pivot and you say, "We're looking into this. It was a tragedy. We're looking into more information of what happened. What I'm here to focus on is patient safety and how my hospital is committed to good outcomes and patient safety." Pivot. And now you talk about patient safety, right? And then they try to bring you back. What the most important thing is how we are looking at identifying and getting people through the hospital with great, excellent patient care. And you answer the question you want to ask. But this is why it's really important before you have a bad outcome of how to get that media savvy and learn how to deflect some of that negative attention when you don't want it. And this occurs, right, not just at professionally work, but also in our relationships, fighting with our spouse, our significant others. And I won't go too much into the details of this for time purposes, but there's a fabulous book called The 5 Love Languages. Now, I told you I'm a D personality, so I'm not one of those like touchy-feely people, and I was like not sure that I bought this at first, but I highly recommend it. And the premise behind it is that everyone has 5 different ways of sort of interpreting love and affection, and oftentimes it's not what you think. My mom is a huge gift giver. Like, I could care less about gifts. She will spend 6 hours at Hallmark, like finding the perfect card that my kids like don't even read. They just open it up and like, can I have the $1 bill inside of it? But she's really hurt when people don't remember her birthday or don't send her a card, because that is her love language. And knowing what you are and what your spouse is really effective ways that I've seen people go through marriage counseling and through some difficult times of understanding how to better communicate with our spouse. And when we're fighting with our significant others, it's using I statements. So you can often talk about how it made you feel rather than criticizing what they did. So for instance, if my husband travels a lot on the weekends or is doing his conference calls in the evenings, when he prioritizes his conference calls in the evenings, it makes me feel unimportant to him. The trick is you can't say, when you do X, it makes me feel like you're an asshole. Like, that doesn't try to land so well. In general, you want to praise in public or tell people how awesome they are, make sure they get that public recognition. One of those love languages is words of affirmation. That is actually my husband. He loves it when people put a little shout out on social media or recognize that he did something good. It makes him feel good. It's important to his ego. If you're going to criticize someone, though, you do it in private, right? Nobody wants to be belabored in front of their peers. I did my training at UNC in Chapel Hill, and Tintin Alley she's like the mother of emergency medicine. She wrote the textbook. And I went there because it was such a huge honor to work with her. But God forbid you made a mistake. Tintin Alley would literally run and chase you around the department. Like, you did what? Like, in front of all the nurses, and it was so humiliating. And I was so afraid to make a mistake in front of her. So make sure you criticize in private. And knowing when to pick your battles. All of us have limited political capital, whether it's with our department, our hospital, our family, of knowing like when is sometimes it's just better to be at peace and give them a win, or find somewhere in the middle where it's just not worth kind of, is this the hill you're going to die on? And know when you really can't get anywhere. If you've ever had a job where you feel like I am hitting this glass ceiling, and no matter what I do, no matter how hard I try, like this leader is just not recognizing how I'm contributing, and I feel like I'm just hitting a wall. Of knowing when maybe it's not the right job. Maybe it's time to switch professions. Maybe there's another opportunity, and kind of appreciating that sometimes when one window closes, another door opens, and it's the right opportunity to kind of switch gears and start somewhere else. But for us, most time, it's not managing conflict internally, it's managing conflict in others. And Dr. Seberg kind of touched on this, of how to kind of define expectations and set culture and behavior early to try and help establish those ground rules. So I will skip over this. In general, you want to investigate the backstory. A lot of those conflict entrepreneurs, they're all about, again, that binary of us versus them. That is a very dangerous mindset. And the more you can reduce the binary and help that individual or a group of people understand that there is actually a whole range of options. It's not just treatment A or treatment B. There's many different ways in between that we can compromise and kind of find a win. When you have two people in your department fighting and they both come at you with information and they're like ready to like kill somebody, is investigating the backstory. Oftentimes they come with one story, someone else has something totally different, and the truth is usually somewhere in the middle. But the worst thing you can do is try to jump on something and to be reactive, only to find out more information comes out a day later and you were totally wrong, because that further erodes that trust that is so really the pivotal part of high conflict. And when in person, you can do in-person meetings, having one-on-one meetings as opposed to texting or Zoom calls, it gives you that chance to develop that rapport. So the purpose of high conflict and shifting out of it, it's not to win, it's not to avoid conflict. Avoiding conflict is really part of what we do in emergency medicine. It's about creating a common sense of shared responsibility, that we're on the same team. We may have totally different political views, we may have totally different families, religions, whatever, but we're here to solve a common problem. And this is about the patient, or this is about the hospital, and we're going to work together to find a solution. Even if we disagree on how to best approach it, we're going to find something that works for everyone. And creating that sense of unification that our country, our hospitals, our departments need so desperately right now, and why it's so important for your leadership skills to really emphasize this. And so with that, I think I got us back on track with time. Thank you very much.